individual experiences that are not necessarily the worst thing in the world, but there's a lot of only very good or very terrible things on the internet.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hello. I'm Molly Jacobson, editor-in-chief over at dogcancer.com, where over 40 veterinarians, veterinary oncologists, cancer researchers, and science writers like me pull together to bring you better information today so you have no regrets tomorrow. On today's show, we're talking about how to maximize your investment if you go to a veterinary oncologist. Some people just go once so they can understand all of the options available to them from conventional medicine, and others go once and then decide to continue and pursue whatever treatments are offered by the specialist. Either way, it's more expensive than a general practitioner vet appointment, and it's a lot longer. So you want to get everything you can out of that appointment. They are really there for you during that appointment. They do not have dozens of other people waiting. They are exclusively focused on you, and they're ready and willing to help you understand your dog's cancer diagnosis and really understand what the prognosis is, what the likely outcome is, and also what treatments they might have to offer, and to give you feedback on whatever else you may have found. So today, James Jacobson is talking to Dr. Megan Duffy. She is a veterinary oncologist. She is kind and compassionate, very, very, very helpful, and she's going to walk you through that first appointment, what to expect, what to bring, what kinds of questions to ask, and how to get the most out of it. Because when you're paying between $200 and $250 for 1 hour, you want to make the most out of that time. And now let's go to James Jacobson and Dr. Megan Duffy.
Hello, friend. Welcome to Dog Cancer Answers. If your dog has cancer, or you suspect your dog has cancer, and you decide to go to a veterinary oncologist, you may be stressed out a bit. I know that I am whenever that has to happen, and I've had my fair share of that in life. We are joined once again by a veterinary oncologist, Dr. Megan Duffy. Hello, Dr. Duffy.
Hi, thanks for having me.
So when you go to someone who has a lot of fancy letters, you end up paying a lot of money. And we'll talk about that in a future episode of Dog Cancer Answers. But if you go and you want to make the most of the investment, and most importantly of the time that you spent to get all those fancy letters, and your time, very limited time with the dog, what do you recommend that people do ahead of time to prepare?
I think this is such a good question and has a few different components to it. First and foremost, we will be, or your oncologist will be, calling basically every veterinarian your pet has seen in the last few years to try to get any records, test results, imaging, etc., so that when you come to that appointment, I have already reviewed your pet's records, that I've looked at all of those things, gone through and already kind of, made some determinations about where are we at, what's been done so far, what do we know. So we've done some legwork beforehand, but by that same token, it is never wrong to bring a copy of records just in case, or a CD of imaging, because we know that things happen, or just to say, hey, here are my records. What do you have? Do I have that whole picture? And what else I think is really nice and really, really cool is, have you done some Googling or research? Obviously, Google isn't the starting point, Google isn't the end point, but it's a starting point. What kind of baseline information do you have, or thoughts on things that you've looked at? And what I think is really nice is when people do come with a list of questions or things that they've heard about. Maybe they've listened to a podcast about a certain treatment or something like that, to say, hey, is this a fit for my dog? Is this going to be a good choice? Really, so that we have a good idea of, well, what are your goals? What are your expectations, so that I can meet them? And I will actually ask, what are your expectations for this visit? What do you really want to get out of this conversation, so that we make sure that we end our first consultation knowing that your needs have been met, essentially.
Let me tease both of those answers a little bit, and we'll get into some more things to bring. But the fact that like you or your staff are calling around to every vet that your dog has seen, I guess that speaks to the relative state of electronic medical records. Mm-hmm. How bad is it? I mean, I know I've worked with some veterinarians and some physicians who are like, they don't know what a computer is. They're basically they're just dealing with paper. And then, of course, some people are in there with their iPads and their little Apple Pencils and doing all sorts of stuff. What is the state, or at least what is your experience with medical records and how easy it is to obtain that information?
That's definitely hit or miss. There are some clinics out there that are entirely paperless. They're fully electronic. Everything is integrated in. It's very plug and play. And there are others where we've got 20 handwritten pages that we are scanning in one by one, and we're doing a little bit of guesswork for what each individual word might actually be. But that's okay. That's part of the fun in trying to figure things out.
So that's where the fax machine and the scanners are going in, mm-hmm. and the deciphering of their handwriting. Do you find that the medical records are a little bit better kept, or at least more electronic when it's from a big practice or a small practice, or does that not have a bearing?
I think we see a little bit of everything. I'd say there's definitely been more of a trend toward electronic medical record keeping. And it can be a big switch at first for an individual clinic or hospital, but then it becomes so easy once it's already laid out, and then you can type a couple of things or update a physical exam. And then I find that they have been more complete than maybe in the past where you see a scribble of healthy pet and that was your only note that day. So it's definitely gotten more detailed and more complex, and integrated in lab work a lot easier that way, I think, as well.
Now, speak to bringing the imaging. So if your general practice vet has a sonogram or an ultrasound or something like that, or x-rays, you should bring a copy of all of that.
It's definitely beneficial. Usually what we like to do is get that imaging in advance, especially assuming that most of it's going to be digital. We can upload it to our server. We can integrate it with whatever additional imaging is taken throughout the pet's lifetime. And then we have that basis of comparison. And that can be really, really helpful. Sometimes, though, maybe the pet went for x-rays the day before their consultation with their specialist, and perhaps they didn't get uploaded yet. So maybe it's a safe thing to even, bring them on a disk just in case and say, hey, do you have my most recent images? We just updated these the other day. And that can be just a nice way of not having this awkward 20-minute delay while we're calling for additional records in the middle of your consult.
And now, in this day and age, we should know this, but it's a good reminder. We own our medical records regardless. So if you got your vet to do it and you decide you want a second opinion or a third opinion, go somewhere else, though all that data, those files, those images are your property.
Yes, and at any point in time, for any reason, you can request an entire copy of your pet's medical records, imaging, etc., and that will be provided to you.
Okay, so when you talk about like all the vets your dog has seen, how far back would you go?
I would say at least in oncology, most things have not been going on for years and years. Usually as a little bit of overlap, we tend to request at least the last 2 years of the pet's medical record. Sometimes it means we get their entire life of medical records. It's just sometimes easier to click a button and send it that way, and that's just fine. Right. More information is never a bad thing. But typically we request the last 2 years.
And then in terms of the type of vets, because obviously some of our listeners use, holistic vets, and some of our listeners use general practice vets. There are all types of different vets. Do you want the records and information from all the different veterinarians who may make up the vet team?
Absolutely. This is interesting. I saw a patient yesterday who had seen their general practitioner, another oncologist, and a holistic vet before they came to see me for a second opinion or a fourth opinion or whatever that ends up being. But it was very useful to have an idea of what's been going on, how has this all transpired, what have the recommendations or conversations been up to this point, so that I'm not jumping in blindly saying, have you talked about this? Have you discussed X, Y, and Z? Where are we at? But it's a little bit better laid out.
And then in terms of the second point in terms of Dr. Google, and it's nice when a veterinarian not only recognizes it, but sees its benefit. Coming in prepared by having obviously listened to all the relevant episodes of Dog Cancer Answers and looked at our blog and all that, but, Googling and getting all sorts of information, how much is too much? Because can be a little overwhelming, and how much is probably not enough that you really could do a little bit more to prepare yourself with the questions so that you can make the best time with your oncologist?
I think a little bit of Googling is very reasonable, especially a truly veterinary website. VIN, or Veterinary Information Network, does a lovely vet partner, which is really geared toward pet owners, or things like that. I don't expect anybody to have read all of the relevant literature in PubMed about a given tumor type. That is way overkill, and it's easy to take that out of context. But it is nice to have some sort of an idea of what this might mean, or some options. I think it's very easy to go down this rabbit hole of individual experiences that are not necessarily the worst thing in the world, but there's a lot of only very good or very terrible things on the internet. And I think that's where this is a great starting point. Background information is awesome. We just can't go too far without kind of reeling it in and making sure that we're still on track in terms of what is going to be relevant to your pet.
And so come on with a list. You think paper and pencil is good? Do you want people to record it? Or what are your thoughts in terms of how to really memorialize and be able to understand what's going on in that consultation?
I have a lot of families who do come in with a paper and pencil list of questions. And sometimes, especially if there are family members who can't be present and they have specific questions, that's a great way to get them out. I have been recorded, both voice and video, and all of those things, or had somebody who was not available to come in person be on speakerphone, and that's absolutely fine. It's whatever media you need to get your questions answered. And of course, the follow-up is everything we are going to talk about is going to be typed up and summarized for you, emailed to you, and emailed to your primary care vet, just so we have that good continuity of care and we're all on the same page. Some people are very active listeners. They want to write things down. They want to take notes, even if this will be provided later. Love that. And some people say, great, I'm going to throw away my pen and paper and just listen and soak it in. So no wrong answer as far as that goes.
So what should someone expect from their first visit for one of these initial consultations with an oncologist?
I would say the biggest thing is expect this to take time. This is not a general wellness, simple, straightforward visit. This is, my pet has just received a life-changing diagnosis, and I would say expect this to take at least an hour. It is a lot of talking. And we really want to unpack, what is this diagnosis? What does it mean in general? What does it mean for your pet? What are our treatment options? What do those look like in terms of quality of life, time, financial, emotional, and timing investment? What's going to be the right fit? And then decide, do we need to do any additional testing? Do we need to do anything else to decide if this treatment is appropriate? And then oftentimes then the next step is doing some more diagnostics or starting treatment, things like that. So I would say expect a minimum of 1 hour of talking in the room before anything else happens.
And then you find that obviously you allocate an hour for it. So you have so oncologists are recognizing that you're going to have a lot of questions, and they've allocated that time. This isn't a short 20-minute visit.
Oh, absolutely. This is really your time to ask all of those questions and get a really clear understanding of what's going on. So
what about the concept of are there any treatments? Are they going to be okay, like a general practice vet, you go in, and then we're going to start this thing, or we're going to do this test. Is that something that can be expected?
Absolutely. And that is one thing where obviously this is a very emotionally charged visit. Sometimes we just need to go home and absorb the information and think about things. But if you're coming out of that consultation saying, I'm very comfortable, I'm ready to rock and roll, let's start treatment, it can absolutely happen same day.
Anything that you might suggest people not bring to the initial visit?
That has definitely changed a little bit since COVID because depending on where you're at, you may be curbside and doing this over the phone, on speaker in your car or with perhaps one or two masked people in a room. And that has gotten away from, please don't bring all of your neighbors and cousins and extended family and all of their children and have 10 people in a room asking a lot of questions, because that can be really distracting and overwhelming, and sometimes it can make things a little bit tougher. I don't mind, if you got to bring your kids, that's absolutely fine, as long as they're, entertained and able to do their own thing so that we don't get too far off track. Other pets sometimes are okay as long as they're reasonably well behaved. I don't mind that at all. So the other attendees to the appointment, that's pretty simple and pretty easy.
Now, this may sound like a stupid question, but I will tell you why I'm asking it later. Do you have to bring your dog?
Yes, that is actually not a stupid question, because every so often families come and say, I'm ready for my consultation. You've got all of Sparky's records, let's roll. And for pretty specific legal reasons, I can't make specific recommendations for your pet without doing an exam and establishing a relationship. And it may seem silly, you've got all of my dog's records. Don't you know what you're going to recommend? And in very vague terms for the disease, kind of, yeah. But I need to meet your dog and make sure that whatever we might be talking about is really going to be a good fit based on how they are on physical exam, if they still have a tumor in place or if it's been removed, and how is that scar healed, or, how is the dog's overall health today? So there are so many things that go into it where, we really can't do a whole lot unless the dog is physically there at the appointment.
So in terms of surprises that you've encountered during some of these initial consults, do you have any that come to mind?
Let's see. Surprises would be every so often we will get off track, and perhaps families will bring a different pet and say, well, gosh, while you're here, can you look at Fluffy? Can you do X, Y, or Z? And that's not always
2-for-1
time that's built in my day, or I'm maybe not the most appropriate person to be evaluating Fluffy's orthopedic condition as an oncologist. It's just, it's not the best place for you to spend your time and money. Probably some other things, I think surprises that are not as silly but are tough are when families have completely unrealistic expectations. And that can be for a variety of reasons, but maybe say, well, I read on the internet that dogs with this condition can live for, 10 or 12 years. And I'll say, well, gosh, unfortunately, our typical outcome is more like 10 or 12 months. And something like that, where I've completely dashed their hopes just from a misunderstanding. And that is a little bit tough to recover from. Or families who are completely blindsided by a prognosis, which I think that's where maybe a conversation with your vet or even a touch of Googling on the side can help a little bit.
So you should come in prepared and kind of understand the overall what the expectations and the prognosis is, so that you're not flabbergasted when the vet tells you the news.
It is really nice to have some understanding of, is my dog's prognosis days? Is it weeks? Is it months? Could this be years, even in really broad brushstrokes, so that you don't come in saying, my dog's going to have her normal lifespan, and for somebody else to say, gosh, that's really not the case.
Can you cover something that we've talked about on this show before, but I don't think we can talk about it too much, which is, please define median life expectancy.
Absolutely. And what we usually speak in median life expectancy or median survival time. And the best way to think about that is that everybody's outcome for a given disease and a given treatment exists on this bell curve. And the very middle of the bell curve, that's the median. So it means that at this point in time, 50% of the patients that we've treated are still with us and 50% have passed away. And so it's a reasonable expectation if you are that average typical pet. And we don't use averages because they're very easily skewed by someone who does really well or really poorly. So it's typically medians. And medians are a good starting point. They're a good idea of perhaps what's typical, if there can be typical in oncology. It also means that for every pet who does phenomenally better, somebody doesn't do as well. And there still is that little bit of a range of outcomes.
Because those outliers can really skew things. And if you're an optimist or a pessimist, you may stick to hearing those numbers and not understand the math term median.
Absolutely.
Which I think is so common. It's so common. We are going to have you back and talk about this in much more depth on a future episode of Dog Cancer Answers. But let's talk a little bit about the price tag for this initial consultation. Now, obviously, you are in Minnesota, and I'm sure it's more expensive in New York or Los Angeles. But what can someone expect in terms of a range for an initial oncology consultation?
I would say for an oncology consultation, again, taking in some regional changes, and every hospital is different, I would say you are probably going to spend $200 to $250 for that first consult. And that's a lot of sticker shock if maybe you hop over to your local vet and maybe spend $40 or $50 on an exam fee, and that's your normal. So much of that comes in with the background, the time it takes for us to comb through your dog's entire medical record, the time we're going to spend with you in the room and really give you as much information so that you can make good decisions as possible. So this is not supposed to be a $200 consult that lasts 5 minutes. This is supposed to be a pretty long process so that it's not just cost, but also just the value that you get from that visit.
Dr. Megan Duffy, thank you so much. If you have any final thoughts, I'd love you to share those with us. And we'd love you to have you back again. But any final thoughts on what to do to prepare for your visit?
I'd say come on in with an open mind, have your questions ready, and we'll go through everything and make sure that wherever we go from here, everybody's really comfortable.
Dr. Megan Duffy, thank you so much for being with us today.
Thank you.
Hey, dog lover, I hope you found that helpful. Whether you're going once or multiple times, getting the most out of that investment that you're spending at the veterinary oncologist is really important. It'll make you feel like you're doing your best by your dog and also your wallet. I hope you'll share your own thoughts and experiences in the comments section. Don't forget to like and follow us for more great videos and advice if your dog has cancer. Join us at dogcancer.com. Join our Facebook community at dogcancer.com/support. And I'll see you soon.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.